Okay, pretend for a moment that this gummy bear right here, a Halloween favorite, is a stem cell. Well, many of us have heard of stem cells, but what are they and how do they work? Well, Dr. Bill Johnson of Innovations Medical is going to go trick-or-treating with us. He's going to have a simple instruction or illustration to help us understand these stem cells and how they work. Dr. Johnson.
Good morning.
This is going to get interesting.
Yeah, we're going to have some fun with it and try and make something that's out there a lot and can be confusing. Try to make it simple.
Okay, so let's talk about what makes stem cells so special.
Well, stem cells are a special kind of cells that can do two things. Let me get you to move the gummy bar. So let's say that M&M is a stem cell.
Okay.
What that stem cell can do is make more stem cells just like itself. Now, if you're a heart muscle, if you're a muscle, if you're a brain cell, if you're a cartilage cell, you can't do that.
Okay.
You can't make new copies of yourself. So the ability to make new copies of yourself is really important when we think about stem cells. Potentially, we could fill the studio with yellow cells from a single M&M.
Okay, so this is powerful stuff. So how do the stem cells...
Hang on, because there's another thing that stem cells can do. They can become other types of cells. So our yellow M&Ms can become red M&Ms.
How do they do that?
Or any color M&Ms, but that's not all. Our M&Ms can become Hershey's Kisses. So if these were fat cells, they can become blood cells, they can become cartilage cells, they can become brain cells.
Wow.
All because our yellow cell can make new ones and become other kinds of cells. So that's what makes stem cells so special and why there's so much excitement about them.
And because the healing properties here are outstanding on what they can do to repair
especially when
your own stem cell for your own body.
All of the cells that can't do these things.
That's great. Okay, let's even illustrate this further, because stem cells, how are they so smart? How do they know where to go and what types of cells to become?
So that's the next question. So how does the yellow M&M know it needs to become a red gummy bear?
Yes.
So we've got a little a demonstration here that we're going to use some of the crew here. Yes. So we've got growth factor A, and growth factor A is this person with sore joints. So they've got growth factors. And we've talked about growth factors as being the text messages that cells send between each other.
Right.
So she's going to send us a text message here.
And she's sending a text message that says she's growth factor A, sore joints, and then
she
receive that text message.
And it says she likes M&Ms. So the stem cells go out to her, and there come M&Ms so that they can make new cartilage or whatever the joint needs. So now let's go to B.
These stem cells are brilliant. Growth factor B, damaged nerve tissue.
So if there's damaged nerve tissue, if you've got a neuropathy, if you've got Parkinson's disease is one that's being working, if you've got strokes, multiple sclerosis is an area that's being researched quite a bit.
Okay.
So again, they send us a text message, and on this one, the text message says that she likes Hershey's Kisses. So here they come.
Trick or treat.
Here are the Kisses. Okay.
Right there.
So she gets Hershey's Kisses because the stem cells can go there and then become what that damaged tissue needs.
Okay, growth factor C,
growth factor C is damaged lungs. We're seeing really good results in chronic obstructive pulmonary disease. We're not treating the symptoms. We're actually changing what's happening in the lungs. And so again, if she sends us a text message, hey, I'm lungs, I need help, and she likes gummy bears.
Yes.
Okay, so here comes the gummy bears.
Trick or treat.
Because the growth factors from the lungs say, I need that particular type of stem cell, the cells can go there and then become what that tissue needs.
I know that, Dr. Johnson, I saw how excited you got when you saw these preliminary testings that were done using your own stem cells to repair. You said you saw amazing things happening in the human body.
We're part of a network, a nationwide network of doctors that are doing this, and we're seeing some really remarkable results. Patients that have been told they have knee replacements, 80% of the time they're seeing improvement.
Yeah.
And most patients are not having to go on to knee replacements, and that's just one example. There's some amazing results. And we're just beginning to really be able to use this technology to help people.